we're done dealing with the mothers. Now we are using this different AI technology again and looking at the babies who might have cerebral palsy. So let's dive deep in. Without further ado, I'm talking about a systemic review, AI-enhanced play therapy for pediatric cerebral palsy rehab. I love the title by itself. Okay, so there are 2 to 3 per 1,000 live births worldwide that are impacted by cerebral palsy. The key deficits that we find in babies with cerebral palsy deficits are motor coordination deficits, balance impairments, muscle tone abnormalities, and functional mobility limitations. So limitations of traditional rehab are repetitive in nature. So conventional exercises often involve repetitive movements that lack variety, leading to monotony and decreased engagement over time. Same movements day after day, week after week. There are time-intensive demands where traditional approaches require significant time commitments from both children and caregivers, which are apparently sometimes new moms if the babies are young, with sessions often lasting for 30 to 60 minutes. Fitting therapy into already busy schedules is a big hassle. Excuse me. And the third one is resource-heavy requirements. Conventional rehabilitation is often resource-intensive, requiring specialized equipment and professional supervision that may not be readily available, limited access to specialized resources. These limitations often result in reduced motivation and adherence, crucial factors for effective long-term outcomes. The promise of digital play therapy transforms clinical exercise into interactive, goal-directed tasks. AI analyzes user performance in real time, dynamically adjusts task difficulty, feedback, and challenges. Virtual reality, immersive environments, augmented reality, enhanced real world, and motion sensors, real movement tracking. This is a picture of one of the child that is engaging in digital play therapy technologies. The objective of this study is to synthesize evidence from 2015 to 2025 regarding the effectiveness of driven and game-based rehab interventions in improving motor function, engagement, and functional independence among children with cerebral palsy. So the interventions resulted in we used AI-driven interventions and game-based rehabs, which created motor function improvement, functional independence, engagement enhancement, and in pediatric cerebral palsy. Systematic review framework followed these guidelines. We identified, screened, selected, assessed, extracted, and synthesized the data. It ensures transparency and replicability of methodologies. The inclusion criteria in our study is published in English. The research published in English between 2015 and 2025. Children or adolescents aged 18 or younger with CP. Interventions involving AI-enhanced, game-based, VR-assisted play therapies. Study types, RCTs, quasi-experimental studies, pilot studies, and systemic reviews. Studies reporting quantitative assessment of motor function, balance, coordination, and engagement or functional independence. The exclusion criteria is studies involving adult participants or individuals with other neurological conditions. Papers focus solely on diagnostic AI tools without therapeutic interventions, non-empirical publications like commentaries, letters, and theoretical articles, studies lacking measurable outcomes or sufficient methodological details. Data extraction process. We use systematic extraction using predefined forms. We captured essential study information, the author, the year, study design, country, sample size and characteristics, intervention details, outcome measures, and results. The quantity assessment applied Pedro scale for RCTs and quasi-experimental studies used AMSTAR2 for systematic reviews. Studies scoring 6+ on Pedro scale or moderate high on AMSTAR2 considered robust. Potential risks of biases addressed narratively. Systematic review process. has 842 total records, out of which 214 were duplicated, and 73 were finally having eligibility assessment, and 30 were finally selected. There were a total of 1,512 kids with CP. The age range is 4 to 16, with the mean age of between 9.8 plus or minus 2.3 years. The specific type of CP we looked into is spastic CP, as 78% of the participants were that, and 22% has other types of cerebral palsy. The intervention duration is 4 to 12 weeks. Session frequency is 3 to 5 times a week, and duration is 30 to 60 minutes. And if you look at the geographic distribution, most of the population is from Asia and Europe, and another country that included was North America, including US and Canada. The remaining all countries contributed for 12%. So out of the technological categories, AI adaptive exercise games were 12%. And virtual reality is 9%, remaining 2 takes the remaining percentage, which is motion capture games and robot assisted platforms. So the distribution of studies, the AI adaptive exercise games, interactive games with adaptive difficulty based on performance metrics. So the difficulty of the game gets higher if the patient is participating and doing well, and it makes it easier. So the child is always motivated and creates interest to participate in the game. So it is not a repeated failure, or it is not boring for a child who can do better. Virtual reality immersive environments are used for motor skill training and engagement. Motion capture smart games were used to sensor tracking movements for interactive gameplay. Robust assisted AI platforms were used with AI for guided physical therapy. 85% of the studies showed substantial motor improvements. Clinical significance. These improvements translate to meaningful functional gains in daily activities and mobility for children with cerebral palsy. The study insights resulted 29 out of 30 studies reported improvements. Largest improvements were seen in motor development. Adaptive AI interventions showed 15 to 20% higher improvement. The AI adaptive algorithms demonstrate significantly better outcomes compared to static games in cerebral palsy rehab. AI adaptive games are dynamically adjusting task difficulty based on real-time performance. Static maintains fixed difficulty levels throughout the session. Personalized AI protocols match difficulty to individual performance. It was found that AI-driven adaptive algorithms demonstrated 15 to 20% higher motor improvement compared to static protocols. To check balance, they did Berg balance scale improvement, and there was an improvement of almost 12.6 with error variation of 4.1, and superior results with AI training. Traditional balance board exercises and were compared with AI VR balance training, and AI VR balance training was 1.3 times greater change in balance compared to traditional balance board exercises. AI VR intervention showed superior balance gains and significant improvements in functional mobility. It was assessed, the balance is assessed in 18 studies using Berg balance scale and center of pressure measures. There is superior adherence with smart game interface. Smart game interfaces exceeds 90% adherence in 22 studies. AI enhanced play therapy demonstrated superior engagement rates. Engagement scores improved by 31% plus or minus 6% variation. And adherence rate comparison, if you see the chart here, there is smart game interfaces where people or kids were engaged at least 90% compared to conventional therapy, only 68% showed adherence. So smart game interface has significantly higher adherence rates. When we look at the motivation as well, with AI-enhanced therapy, the babies were more motivated, and you see there is 90% compared to traditional, which is 68%. So there is at least 31% higher engagement with AI therapy. The standard deviation is 6%. Improved motivation directly impacts therapy adherence. Higher engagement correlates with better motor outcomes. Key findings for cognitive and psychosocial outcomes. 9 studies explored cognitive and psychosocial benefits of AI-enhanced play therapy. It showed improved attention. Children showed enhanced focus and sustained attention during therapy sessions. Emotional stability. Participants demonstrated improved emotional regulation and stability, greater social interaction, and participation in group activities. There is higher patient satisfaction in AI-enhanced therapy compared to traditional therapies. So if you see the tabular form here, a comprehensive analysis of 30 studies demonstrates significant improvements across multiple domains of rehabilitation outcome. The outcome domains that they looked into is the gross motor function, which has the highest improvement. Balance, hand dexterity is another one where you've seen highest improvement. Therapy management is another area where you've seen good improvement, and cognitive gains. Overall, the highest improvement was seen in therapy engagement because the kids are very interested in playing games for them rather than feeling it like therapy and exercise. So therapy engagement and adherence is very well improved with technological advances. The role of AI with respect to personalization, user performance, AI algorithm, and dynamic adaptation. How AI personalization works. Adaptive algorithms continuously monitor performance during play activities. Task difficulty is dynamically adjusted based on real-time feedback. Performance threshold trigger personalized adjustments to challenge and support. Benefits for rehab, it minimizes frustration, boredom, sustaining engagement. It aligns with neuroplasticity principles, emphasizing repetitive practice, provides optimal challenge levels for motor learning and recovery. AI-driven personalization is crucial for the effectiveness of these interventions, translating into higher intensity and repetition of therapeutic exercise. Motivation as a catalyst for neuroplasticity, enhanced engagement, higher exercise intensity, increased repetition, neuroplasticity adaptation. AI-enhanced play therapy increases engagement, higher engagement equals more intense therapy, more practice equals better outcomes. The impact, brain reorganizes itself, forms new neural connections, enables functional recovery. A holistic approach to rehabilitation, AI-enhanced play therapy addresses multiple developmental domains, simultaneously creating a comprehensive rehab model. So for motor development, they worked on problem solving, decision making, social interaction. Cognitive growth, we worked on task-specific practice, adaptive challenges, neuroplasticity promotion. Emotional well-being is mostly targeted at self-efficacy, intrinsic motivation, positive emotional state. AI-driven personalization ensures tasks that are managed or matched to cognitive abilities, fostering self-efficacy and intrinsic motivation. Limitations and research gaps. Research limitations will be intervention heterogeneity, where diverse interventions make comparisons difficult. Exergames, VR, motion sensing devices, robot-assisted platforms. Limited long-term data. Only 6 studies extended beyond 3 months follow-up. Study scale constraints. Most studies were small scale or single center with limited generalizability. Research gaps is cost effectiveness. Few studies addressed cost effectiveness or accessibility, particularly in resource limited settings. Safety and ethics. Ethical implications underexplored, data privacy, informed consent, unsupervised home use, safety. These are the research gaps that need to be addressed still. Clinical implications and future research. Clinical implications, effective adjunct, complements conventional physiotherapy, personalized tailored interventions for patients, objective tracking, data-driven progress monitoring, home-based extends rehab beyond clinic. Future research directives or large-scale RCTs needs to be addressed. Standardized AI interventions, long-term studies needs to come to address the efficacy and generalizability to the population. Cost effectiveness is important. Accessibility in resource-limited settings, ethical guidelines, data privacy and safety protocols needs to be taken care of. Continued collaboration among clinicians, researchers, and developers is crucial, as these can address some of the gaps that we talked about. Concluding remarks, AI-enhanced play therapy is a transformative child-centered approach to pediatric rehab, significant improvements in motor function, balance, coordination, and therapy adherence, positive influence on cognitive, attention, emotional well-being, and social participation, represents an essential adjunct. We also noted that because of play therapy and creating a fun environment, the children also have less stranger anxiety, and they were able to handle the situations and surroundings better because they are enjoying the task they're doing. Safe, effective, and scalable interventions for children with cerebral palsy require a collaborative approach which includes clinical, developmental, and research optimization. Thank you.